The topic is miscarriage and some of the causes, and particularly could stress cause miscarriage. It's never really been proven that stress itself can cause a miscarriage. But of course, it's a circular argument because miscarriages make one very stressed. So after the fact, a woman's going to be sad and stressed about having a miscarriage, and it's tempting to feel like that stress caused it. But again, no proof that that's the case. And so the last thing you want to do is worry about worrying. In other words, if you think stress was the culprit, you're going to worry more about being stressed, which is never going to allow your stress level to go down. So sometimes just living life, in other words, if you have a job, going to work 8 to 5, you can't think about your infertility. You can't think about your pregnancy and whether you're going to miscarry. And not focusing on it is probably therapeutic. But the vast majority of miscarriages are understood, and they either have to do with the health of the embryo, particularly chromosomal issues, or issues with the uterus that are not controlled by the woman. She has no control over that. Her stress, her thinking, her worrying is not causing this poor outcome. So I tell patients, in short, don't blame yourself. That's not productive. If you have a failed pregnancy or what is known as a miscarriage, my advice is not to focus on your anxiety or worry, but go to a fertility specialist and get a proper evaluation to determine the cause. Is it a uterine issue? Is it an embryo issue? But again, don't blame yourself.